According to a new preprint study, the rise in cancer deaths here in America spiked in the years 2021 and 2022. And these spikes were in great excess to the multi-year trend. This new study, you can see it up on your screen right now, was published by a research firm called Finance Technologies. Finance, by the way, with a PH rather than an F. And what this firm did was that they pulled data from within the CDC's database in order to try and figure out whether or not the rate of deaths from cancer changed significantly over the past few years. And, well, here's what they found. Quote, "We show a rise in excess mortality from neoplasms, which is tumors, reported as underlying cause of death, which started in 2020 at 1.7% and accelerated substantially in 2021 at 5.6% and 2022 at 7.9%. The increase in excess mortality in both 2021 with a z-score of 11.8 and 2022 with a z-score of 16.5 are highly statistically significant, meaning extreme events." Now, in case you're not aware, the z-scores that they mention here are a measurement tool that's used in the field of statistics. Basically, a z-score measures how far away a certain data point is from the average. And so if a z-score is 0, that means the data point is identical to the average. If a z-score is 1, it means the data point is 1 standard deviation above the average. If the z-score is 2, it means it's 2 standard deviations either above or below the average. That's how that generally works. And in terms of how extreme these findings in the study actually are, well, that becomes extremely apparent when you look at the data on a graph. This graph right here, it shows the rate of excess cancer deaths here in America among people aged 15 to 44. And by excess deaths, it means the deaths that were above expectations. And so the baseline for the graph, it represents what the CDC expected the number of deaths to be in a given year based on historical data trends. And as you can see, they were fairly correct for the past decade. Sometimes the real number of deaths would be a little bit higher than expected, sometimes a little bit lower, but it was usually fluctuating plus or minus a z-score of 1. But then, starting in the year 2020, the numbers began to just skyrocket, with excess deaths increasing by 1.7% in 2020, 5.6% in 2021, and 7.9% in 2022. These numbers, they correlate to a z-score of 12 and 16 respectively, meaning that those 2 years represent extreme outliers from the average. Also, you can see the change represented in this other graph that was included in the study right here, wherein the number of cancer deaths were trending down for about a decade before completely reversing course in the year 2020. And by the way, just as an aside, if in the next few years, like in 2023, 24, 25, if the numbers on that graph go down, well, that doesn't mean that the rate of cancer deaths will have necessarily decreased. Instead, what will likely have happened is that the CDC's baseline estimate on the expected number of cancer deaths will have increased because they would have baked in the most recent data from 2021 and 2022. Meaning that even if the excess number of deaths goes down in the future, the total number of deaths might actually still be rising. Because again, that graph, it's only measuring the difference between the expected value and the reality. Now, in terms of why this is happening, that is still unclear. The co-author of this particular study, Dr. David Weisman, he left the cause of this increase an open question, although he did posit a few possibilities. Quote, "The results indicate that from 2021, a novel phenomenon leading to increased neoplasm deaths, which is cancer deaths, appears to be present in individuals aged 15 to 44 in the U.S. The rise in cancer death rates as underlying cause might be the result of an unexpected rise in the incidence of rapidly growing fatal cancers and/or a reduction in survival in existing cancer cases." Meaning that among the possible reasons are two: a sudden unexpected rise in rapidly growing cancers and/or a reduction in the survivability rates of existing cancer cases. Furthermore, in regards to the role that COVID, the COVID vaccine, as well as lockdowns played into the sudden spike, well, the researchers ended their study by writing that they are currently in the process of parsing the data even further in order to uncover the possible relationship. Quote, "Further stratification is underway, for example, by age and cancer type, to understand these trends and their relationship to pandemic-related factors such as access to or utilization of cancer screening and treatment, changes in health-related behaviors such as exercise or smoking, exposure to COVID-19 disease, or COVID-19 vaccines." Meaning that they're running further analysis in order to test the hypothesis that this might be caused by anything, ranging from the vaccine to COVID to the lockdowns. And on the last point regarding lockdowns, you might remember how 3 years ago, people who were fighting back against the lockdown agenda, they were ringing alarm bells regarding exactly this possibility. In fact, back in the year 2021, at the very height of the global lockdown craze, reports were already emerging showing the possible serious long-term problems. As an example, in 2021, over in the UK, you had this report that was published which found that the dramatic decrease in the number of face-to-face doctor visits could lead to as many as 10,000 unnecessary deaths from cancer. And back then, those UK researchers, they cited two factors for this prediction. The first factor is that across the UK, they saw a dramatic drop in the number of emergency cancer referrals from general practitioners. And according to their findings, this resulted in about 40,000 diagnoses of cancer coming later than they actually should have. Meaning that because people were not going to their doctor for general checkups, well, that means they weren't being screened for cancers, and those cancers weren't being discovered in a timely manner. And then furthermore, even among the people in the UK who did have their cancers discovered during this lockdown period, the researchers noted that the National Health Service, or the UK's NHS, they experienced serious delays in the treatment that they provided to cancer patients. And so, when you combine these two factors, late diagnosis with delay in treatment, well, this 2021 report said that it will ultimately lead to thousands of people dying significantly earlier from cancer than they otherwise should have. Here's specifically what one of the co-authors of this report said to the London Telegraph newspaper, again, all the way back in the year 2021. Quote, "The immediate effect of the pandemic was to delay early diagnosis. There is some evidence to suggest every month treatment is delayed can increase the risk of early death by 7%. Some of it is about patients not presenting, worrying about being a burden on their general practitioner. Some of it is about access problem." Meaning that between the government telling people to stay home, don't go out in order to save lives, and people clogging up the NHS in order to just get tested for COVID if they have the sniffles, that led to people not getting their treatment and not getting tested for COVID. And unfortunately, you fast forward 3 years, and we're now beginning to see graphs like this one here showing massive spikes in the number of deaths from cancer. While at the same time, we're also beginning to see articles like this one here from the Wall Street Journal saying that the lockdowns as a whole protected pretty much no one. But hey, the experts at the time told us otherwise, so I guess we had no choice. All right, just to pause here for a super quick moment. Listen, it's obvious that the financial system is not looking too great. After being pumped up with trillions of virtually free government dollars for many, many years now, well, the stock bubble might actually burst in the near future. And in that process, unfortunately, it could take away the nest egg of anyone who happens to be exposed to it. And so consider taking this opportunity to diversify into something which is beyond the grasp of Washington, D.C. and Wall Street, physical gold and silver. And the best company to use, in my opinion, is the sponsor of today's episode, American Hartford Gold, who, I should mention, is also my own personal gold and silver bullion dealer. And besides myself, they have thousands of 5-star reviews from other Americans, and they also have an A+ rating with the Better Business Bureau. And working with them is rather simple. They have a huge selection of coins, bars, and rounds to choose from. They have super friendly staff who you can call, and they can set up either gold delivery directly to your doorstep, or they can even set you up in a gold IRA. And then lastly, best of all, if you tell them the Roman sent you, they will throw in a free gold coin with your first qualifying purchase. So give them a call. The number is 866-242-2352. That's 866-242-2352. Or you can simply text Roman to 65532. I'll also throw a link to their webpage. It'll be down there in the description box below. If you'd like to go through this data about the excess mortality rates for yourself, I'll throw the link to it. You can find it down in the description box below this video if you're the type of person that likes to dig into the weeds. And then until next time, I'm your host, Roman from the Epoch Times. Stay informed, and most importantly, stay free.